Hey everybody, it's Andre from the Eaglesoft Field Guide. I'm here with a fielder, Rachel. Rachel, how are you?
Good. How are you doing?
Good. And where are you today? What part of the country are you in?
We are in Michigan, the Ann Arbor area.
Awesome. And what's the name of the practice?
I actually am at Washtenaw Community College Dental Clinic.
Awesome. Awesome. Now, you're a federally qualified healthcare center, or is it?
Yes.
Awesome. All right. Yeah, I work with one in the Philadelphia area. I love working with them. They're probably one of the only offices that's kind of was prepared for this coronavirus outbreak, with some of the things that they do on a regular basis. So one of the things we want to talk about today is our progress notes. And in Eaglesoft, we're going to talk auto notes. And for those people who are on version 20 and 21, we're also going to talk about smart notes. And specifically, we're also going to talk about making sure that those notes are signed off. So how many providers in your office, hygienists and doctors?
So it is a dental clinic. It's a community college
Yep.
where we instruct dental assisting students.
Gotcha.
So we actually have doctors come in and oversee the students,
Okay.
along with the University of Michigan dental students come in as well, and those doctors oversee all of the students.
Good. So you're going to have different protocols based on the provider who comes in, obviously.
Correct.
Gotcha. Okay. So as an institution, one of the things, and this is kind of what I do with most of the businesses I work with, is set up these protocols that say, this is how we're going to do it in the office, and this is the protocol you follow, and creating some fail safes so administration can follow up on those things to make sure they're done. So
Perfect.
one of the ways that I really like using Eaglesoft is taking my procedural notes and actually splitting them in half. So for the most part, and a lot of offices will do this, the assistants write the information chair side. When I worked chair side in an office, I would write all the procedural notes that we did, which, how many carps of lidocaine that we use, what cements that we use, what was the shade that's going to be sent to the lab. All those things I would write as the procedure was going on. And
Okay.
then my doctors would then go back and write a comment about those procedures. And that's kind of what I've started to train people with utilizing a digital chart or digital progress notes. It just seems to be easier because I don't know if that's the experience you have, but it seems to be that the doctors never really have time during the procedure to write the notes, and they
Correct.
want to come back later on and write notes.
Yes.
So I'm going to go over here into my operatory, and nothing wrong with my screen. I have my operatory screen sort of grayed out so that the things that we do on top of it don't get overwhelmed. So I'm going to open up some progress notes on a patient and just give you a couple ideas of some things that I like doing. So couple options. There are 3 different ways that you can write notes in Eaglesoft. The first way, well, actually, let's call it 4 ways, but nobody really uses the 4th way anymore. The 4th way would just be the free-form type notes.
Okay.
All right? Nobody wants to do that anymore. Option 2 is under every service code, there is something called the post-procedure notes. And I actually set this up so that I could show people how to do this. But see how my code says crown, and this is a noble metal crown. It says
Yes.
PPN. So I know that I have post-procedure notes attached to this, which in the setup of the code, over here, there's something that says post-procedure.
Okay.
And I actually have, where is it? Maybe it's not set up properly. I actually have a procedure note set up for that actual procedure.
Okay.
So what happens is when I post this procedure to the patient's ledger, the progress notes automatically are added to the progress notes.
Yes.
So there's nothing that anybody has to do. Now, the only problem with that is things change. Procedural notes change, shades change, anesthesia changes. So I'm not a huge fan of that, and I never really use it, but I show people that that is an option. So what happens is at the end of the day, and I don't think, oh, there it is. At the end of the day, I can actually hit this post-procedure notes field, and it will actually show me all the notes that were written, My doctors can just edit those notes. You can see there's an edit button down there. It's grayed out because I don't have anything in there. They could actually edit those notes and okay those notes, and it'll actually show you which notes have been verified by the doctor or not during the day.
Okay.
But that means that the doctor's got to go through every single note and verify everything that was done. I'm also not a fan of it because if I do 4 extractions, I could have 4 notes for that procedure.
Okay.
So again, I don't train on it. I've never trained anybody on it because it's not something I like doing. I just think it also means that the doctors at the end of the day have to spend a whole lot of time reviewing all the notes that were written.
Okay.
Yeah.
Now, a question on that.
Yep.
We did attempt that. And what seems to happen is when it gets posted out,
Yep.
It gets put in the treatment notes at that time, not when the patient not when the assistant puts it in.
Exactly. It's true.
Okay.
Yeah. It's posted as part of the walkout.
Correct.
And again, not a big fan of it because what if doc has a little bit of time and is, wants to write it up, and if they physically wrote something out, all of a sudden you get a secondary note because it was attached to a fee. To a code. So again, not a big fan. I know a lot of people love it. Great. If you love it and it works for you, good, but not a big fan for me.
Okay. And now that would be only if there's not a whole lot of changes in the procedure.
True. And again, that's not the typical dental office. Things change dramatically day to day. And so I'm not a big fan. So let's go back to option 3, which would be an auto note. And under auto note, I'm just going to use that same auto note that I had. I'm just going to choose it, use it, and then as an assistant, I'd be chairside filling in the blanks. We worked on tooth number 3. The tooth was cracked. All right. And patient review. We reviewed the medical history. There were no changes. If I took a blood pressure, it would be here. Any comments about the patient coming in for pre-medication would be there. Yes, we placed topical and we used 2 carps of Lido and we did it through infiltration. So I, as an assistant, I would just be going down here and filling in the blanks here. Shade was A2. And we submitted in with temp bond, whatever. I don't know these things. And we're sending this out to Glidewell. All right, it's due back in 14 days, no comment needed. Inform the patient the root canal might be needed. So I would go through this whole process, filling all this in, all right, and be done. And I'm going to save note. Oh, I have on, I should have not had on my spell check. Okay, but now my notes are in and I'm done. So now what happens is my doctors would come back at the end of the day, they'd go back into notes and they would write a comment about that procedure. So the procedural notes are done and now a secondary note would be done to just explain if there was anything that needed to be done by the doctor. But also one of the things I like doing is, and I picked this up from Dr. Campbell, Greg Campbell in California. I think this is really cool. In California, the doctors are required to put their license numbers in to verify that they wrote notes. And I think it's really cool. So even if you do an auto note, you just kind of leave it a blank space so that the license number could be put in, which means the doctors have verified that the notes were done. So as an admin, we could look at the chart and go, well, there's no license number, so the doctors haven't reviewed that record. Now, it would only get caught if somebody was actually looking back at it, all those notes, and making sure those notes were in. So that's the only hiccup to it.
All right.
Okay. So method number 4 would be to use smart notes. So I'm going to do a crown using a smart note. And let's do CAD-CAM crown. Now, what version are you on now?
20.
You're on version 20. Okay, so you'll have smart notes in your version. And most of the people in the group, based on what I saw in the last poll, most people were on version 20. So if I use that, the great thing about it is now we have the ability to go through, and as you saw me filling in the blanks, now they are automatically filled in based on smart notes. So risk factors, And I have this set up kind of long form to really, again, teach people how to utilize these things.
Okay.
So I can actually pick the procedures, pick the anesthesia types, all those things I can do pretty quickly using Smart Notes. And this is kind of my favorite thing. I love Smart Notes. And right here, you can see and again, depending on the state, a lot of times what will happen is somebody else will do the anesthesia, especially if you have
Okay.
an assistant. I'm sorry, a hygienist who does anesthesia for multiple providers. So I've actually set this up. I'm going to go previous. 2 carps, and then I could actually pick which provider is actually doing the anesthesia. So a different provider than the provider doing the procedure. And then
Okay.
they physically have to type in their license number.
Nice.
Yeah. So, and again, based on a lot of the different things that I've seen across, throughout the country with different ways that people do things, the nice thing about this is I could quickly go through and make sure that this note is completed, just because I'm looking at those, those areas being filled in by the office.
Okay.
So, excuse me. Which one do you typically get? What do you use? Auto Notes?
We typically use Smart Notes. So that is how we have set it up currently to teach our students so that they aren't missing anything. And it seems to help, but then going back through and reading through it to make sure it's accurate is what we find doesn't always happen.
Yep. So from an admin standpoint, excuse me. Oh, sorry about that. From an admin standpoint, the only thing that we're going to be able to do is work with the PTC on a couple of different things. The first thing would be IntelliCares. And do you know what IntelliCares are?
I do not.
Okay. So IntelliCares are these little indicators. And all right, see these little indicators on the side down here?
Yes.
Okay. So these are set up to say if this, then that. So if this, then that. If this, then that. I'm going to take Charles. I'm going to move him to today's appointment just so he's somebody I can work on. So I can actually have an IntelliCare set up that puts a icon on the schedule if the notes have not been written for that patient.
Okay.
So imagine if I get a stop sign on the screen that shows me, okay, this patient has not had notes written for today. It's only going to work for today.
Okay.
And I could quickly go down and go, okay, so there's no notes written for this patient, so I better talk to the provider to make sure those notes are written. Or I need to click on that and go to my notes history in order to be able to read the notes for that day.
Okay.
Just pull this up to make sure that they're accurate. All right. So a couple different things you can do. You could have the IntelliCare to make sure that they were actually written or not. But in your situation, you're going to have to go through and make sure that they're written correctly.
Okay.
All right. And that's just going to be a matter of going, opening them up and reading them. One thing that has been a discussion in the Facebook group about opening a note and making any changes to that note is going to show a modification.
Correct.
So you've got to be careful that, if we're looking at the notes, are we opening, editing them, or if they're fine, just leaving them alone. But be careful if you're opening, and I'm just going to open this note from here, looking at this note and saying, okay, there's no anesthesia listed here. So, okay, they did 2 carps of bupivacaine.
Right.
And I hit save that note. Now, what happens, of course, what happens with that note is it's going to show in the record that note's been modified.
Okay.
And not that it's a horrible thing, but just be aware that whatever, depending on how long after you've done that note, it may or may not show that note's been modified in your record. And if anybody ever unfilters the ledger and looks at modifications or deletions, it's going to show where that note's been modified. And that's not necessarily a great thing. You can see all the modifications I've made here because this is kind of my dummy system. But just be aware that, over time, if you've got people going into a note the day after or something like that, you're going to show a lot of modifications in your system.
Okay. Now, would it look better if the person that modified it is the person that entered that note?
Yes and no. It depends. And again, this is kind of a legal thing. So it really depends on what the modification was. Like me
Okay.
adding, changing anesthesia from one thing to another. Imagine the patient calls and they had a reaction. Okay,
Hmm.
that could be an issue where it's, it said that I did use epi and then I didn't use epi. So that could be an issue. But again, that's why notes should be written contemporary to the procedure. And what we're trying to do is fix something that's, that shouldn't be broken.
Right. And that makes sense in a normal practice.
Right.
In our situation, it's a little different. We do go through and we kind of do chart audits
Yep.
at the end of each week to verify that everything was put in properly, and if anything needs to be adjusted or changed, we then talk to the students and have them make those corrections.
Yep.
So maybe it would be better if we were to do it daily so that it's modified the day of.
It should be. And again, what should happen in progress notes is if you find that there is a difference from what somebody originally wrote to what you now know,
Mm-hmm.
is to do an addendum. All right. So
Okay.
you should really never modify a note. You should always just, and again, think about when I was in a dental practice back in the olden days,
Mm-hmm.
everything was written in pen,
Right.
and you would never go back and, white out something.
Correct.
You would then just make an addendum. You would say, didn't use this, use that, whatever. So that's what we should be doing. Even in a digital chart, we should be doing addendums. It says that we used bupivacaine, but really we use lidocaine, whatever.
Okay.
So that's
So
really
it's
what should happen.
so instead of changing the note, add a new note with the changes.
Exactly.
Okay.
Yeah. And again, from a legal standpoint, it's also better to show this is what we originally had and this is what we have now. And that's why if you look at Eaglesoft, when we show those modifications or deletions, what it does is it doesn't delete it. It just redlines it. It puts a line through it so that you can see originally what was written and now what's in what's part of the record.
Correct.
Yeah.
Okay.
And
All right.
again,
That
you're
makes
in a
sense.
teaching situation, so it's a little different,
Yes.
but it's also a great teaching tool to, so that students are learning to be, accurate and being
Mm-hmm.
able to do it in a timely fashion, and making sure that those notes are accurate based on what was done during that, during the procedure. So
Mm-hmm.
it's a great teaching tool to be able to show somebody what the difference is and what would be a blaring change of things to something that's not. Even something like, patient tolerated treatment, well, fair, or dissatisfied, that could be a big difference if the patient ever questioned the record.
Okay.
Yeah. So, but again, these are teaching tools. And that's why I also like, as I write these notes, to make sure that they follow a pattern so that they can fill it out quickly and easily.
Right.
If the lab is at the top of a crown note, well, we typically don't pick the lab until we kind of get to the end of the procedure. So you kind of want the lab to be down at the bottom and how long it takes for the lab work to come back. Those things should be at the bottom of the record, because that's the sequence that we do things in. So.
Okay. Okay.
And then, I have it again, mine is set up for training, but I have all of my anesthesias here.
Mm-hmm.
And the great thing about making sure you're using an auto note or a smart note is making sure you're writing these out long form so that there is no question which Lido are we using, which, Septicane, because this Septicane, 100,000 as a 1 to $200,000. If you're abbreviating this, as just Septo 4%, which one
Right.
was it?
Okay.
So it's a great opportunity to make sure you're putting those in, take out all the stuff that you're never going to use in your office, but, put those things in as much as possible.
Mm-hmm.
So
Could I ask a question?
go for it.
Where it says, I saw you clicked on auto note
Yep.
and it showed up in the box and you were able to fill it in that way.
Mm-hmm.
But then when we do smart note, it popped up another box and you can't go back and forth really as easily.
Right. So these, before Eaglesoft 20, we used auto notes, which was that way.
Okay.
All right. And the way I always set these up is to put these lines there to force the provider to actually fill those in.
Okay.
What Smart Notes does is Smart Note automatically fills those in for you.
Correct.
So nothing different. And while we're talking, I'm going to actually discard this note, and before it drives me nuts, I'm going to turn off my spell check. Yeah. So now with Smart Notes, we actually have the ability to do that. Oh, it's already off. I don't know why it's on. Okay. But yeah, so I actually have my system set up so that I can show the difference between, and I have them listed. So that one is an auto note. The rest I use are Smart Notes.
Okay.
And a lot of people haven't started using Smart Notes yet. So let's talk about Smart Notes. So I'm just going to show everybody. I know nobody does amalgams, but I'm just going to use this because it's at the top. So you can see these little sort of tags where this is where I would typically have had a line to fill in. But like here, I have optional who accompanied the patient, and this would be the guardian, and then their name. Where I have custom, it means I can free form type something in.
Okay.
And then where it actually has a word like guardian, I actually have over here choices. And I'm going to show you where these are in a different area. But I can quickly pick from my drop-down choices. Let's go over to those drop-down choices. Under list, I've got Smart Notes. And here's my choices. Okay. So here's my guardians. And here's all the guardians that I would have in my system.
Okay.
So if I have a pediatric practice and I want to make sure that I know who brought the child in, I can quickly choose from the list here. And because I have a not available, I could actually type a note like third cousin, fourth time removed, whatever.
Okay.
So that I can quickly make these choices here from my choices that I have as default, but I can also freeform type something. The same way I have my American Association of Periodontology diagnosis, got those choices here. I have just about everything that we would typically have to fill in my core materials, my crown types. Doesn't matter. It's all here. The ones that are in blue are the ones that are defaulted from Eaglesoft.
Okay.
So I typically tell offices, this is a great way to make sure you can just write down all the different things that you do in the office. Who are your referring doctors? If you typically refer out to Dr. Jones and Dr. Smith and whatever, I have all those listed so that as I diagnose a third molars that we're not going to do in the office, I can say, I'm going to refer that out to this doctor or that doctor or that doctor.
Okay.
Doesn't mean the patient's going to go there, but I want my choices there as I told them this is the person I would recommend getting it done. Okay. My labs, what kind of lab work, whatever it is, you can put them in here. And that way, it's less that the doctors have to write out, less, I shouldn't say doctors, less that the providers have to write out because hygiene is going to use the same thing, but more choices as assistants are putting that information in. It's amazing, I get to read notes in offices all over the country and to see how little some people write and how much others write. Pediatric offices, they're writing a lot of things, and I see offices that do sleep apnea who are writing different things, offices who pretty much don't write anything. Some notes I see just say 2750 number 18, and that's all the notes they wrote.
Wow. Yeah.
It's a little scary.
Now, I have a question about the notes. If
Sure.
we are doing multiple fillings on a tooth or extractions, those would go in as separate lines. Is there any way to make it one line?
You could. And again, in my Smart Notes, I would actually, because you can see here, I've got crowns, but I also have crowns with buildups.
Okay.
So you could do, and again, you could do a filling or composite, and you can have one that says multi. And you could have 3 lines that say, tooth blank with whatever, if you use different materials, whatever. So you could do that and have multiples of the same thing within the same note.
Okay.
You probably saw that when let me edit this note again. You can see I have 3 anesthesias that I could use during your procedure. Same thing. You could have filling 1, filling 2, filling 3.
Okay.
In the same procedure. And if you don't use it, you can always just take that line out.
Okay.
Yeah. So I would do that, especially, you'd probably, if you do, you could almost have it called composite quad
Okay.
and put multiple tooth numbers in there. Um,
Would that show up in, would we will be able to number the teeth so we can see it in the notes?
yes. All right. Because once you use that note, or let me get out of that one. I'm just going to use my regular auto note. So imagine if I even use this and did 2 crowns, I could actually click here and say I did both 2 and 3.
Oh, okay.
Yep. And again, and you see mine says tooth numbers. So this would say 2 and 3. All right. And I could say number 2 cracked, number 3. I know I didn't type it right. Failed, restoration, whatever. So you could have multiples within the same notes. And again, depending on when you get down to here, did you use retraction cord at 2, but not on 3? You have to clarify that.
Correct.
But you could, in theory, make one that has multiples of the same thing. I always try to come up with whatever combos I can come up with as I create auto notes or smart notes, so that you have, root canal, post-accord, and crown, root canal, build-up, crown, multiple extractions, whatever. One might be surgical and the other one might be a simple extraction. So you can create combos of those codes. So it's easy. And really what you're doing is copy and pasting parts from one note to another note. But, it would be pretty easy to do that.
Okay. And if we were to do, say, number 2 occlusal composite and number 3 dio composite, if we can click on 2 and 3 for the tooth numbers, but the surface numbers we could not put in. We would just have to write that in, correct?
Right. Well, but if you do it as a smart note, and again, I would have smart note multi, you could do multiples of the same thing. So actually, let me see if I could do that here. Yeah, I could do it here. So yeah, you could do it and actually just put 2 lines with one with number and then surface.
Okay.
Yep. So yeah, you could do it. Yeah. Actually,
makes sense.
Now that you said that, I'm going to make one of those up. Yeah. So that would be a really good thing to do, is to have a composite quad or composite multis or whatever you want to call it, but so that you can actually have multiples of the same thing in the same way I have crown and build up, as opposed to just a crown.
Right. Okay.
That's a good
Very
one.
good.
Yeah, because even I think when it gets to scaling, I think I have in here which quads that we do. So quad, and I can do multiples. Yeah. Which is typically the way you're going to do it. And you said something that I want to make sure everybody knows how important this is. So I'm going to actually click here, open up the patient's chart, and I'm going to switch my patient to this guy because I know I have notes on this guy. So one of the things that I see in a lot of offices that they're not doing, which you made a point to say, and I think this is fantastic, everybody should know this, that little N next to the tooth number lets me know that I have a note about that tooth. And you said it, if you don't click that tooth number when you're writing notes, you're not going to have that, and you're not going to know that you have a note attached to it. So you should be able to right click, go to history, and be able to read the notes about that tooth.
Okay.
Yep.
That's something I did not know.
Oh yeah, but well, you knew to connect it, but that's why you connect it, because I can quickly read, like number 3's got notes. So if I click on 3, go to the history of that tooth, there are my progress notes that I wrote about number 3 way back in 2010.
Very nice.
Yep. So as long as you have the tooth number connected, and so people know what we're talking about. I go to notes history, and you can see right here, as I wrote the note about number 4, there's my tooth number. As long as I put the tooth number in there, it's going to connect back to my chart.
Very good.
Cool.
I like that.
That's it. And like I said, it's from both sides of the practice. If you're on the practice management side or if you're the clinical side. So imagine somebody called and they said, I'm having pain on the upper right. And even as a front desk person, you could come here and say, okay, this is the upper right. All right, there's notes about that tooth. Is it the tooth next to the one where we did the implant? Yeah, it's that tooth that's bothering me.
Mm.
And you can quickly read that note. And I can see right there that the doctor wrote back in 2011 that tooth is doomed, you know, and I can quickly see that there is a note about that tooth. That tooth there, you know, there's a little mesial incisal chip on that tooth. I can see it in 8 too. But if there was a note, I could right click and read the note. There's nothing there, but it would be great to be able to read that note.
Okay.
Yeah.
Now, would that be something that you yourself would do? Say a patient comes in as a new patient, you make your new patient note, but there was a chip on number 9. Do you add a new note that says number 9 chip, or do you attach that to the tooth 9?
I would attach it to the tooth, and I'll tell you why. Imagine, I mean, this is a typical thing. Imagine during a recall visit, and like here's a recall visit here. Imagine during this recall visit, the hygienist talked to the patient about the fact that they trapped material between number 18 and 19.
Right.
And they connected 18, 19 in here. And let's just edit this, and we're going to put 18, 19, and I'm going to put in here in the notes, trap food 18, 19.
Okay.
All right.
Makes it a lot easier to find.
Exactly. And imagine they're getting interproximal decay. And I'll have to refresh this, but imagine they're getting interproximal decay between 18 and 19. And I look at my notes and I go, oh, wow, that's right. Back in 2006, we were telling you should get the little proxy brush to clean there. Did you ever start using those? No, I didn't. Well, that's why you have the decay there.
Okay, yeah.
All right. So it's a really cool thing to be able to do. And I try to tell people that once you start utilizing those notes over time, you're really, really, really going to love the fact that you can just quickly look at this and say, okay, I've got notes on that. I've got notes on that. I've got notes here. I've got notes there. You know, I don't suggest that, you know, you're right. Like if you're doing scaling and root planning, don't put a note on every single tooth in that quad.
Right.
Because it's just going to have an in across everything. But what I do is you can see on my thirds, I've got notes. And typically those notes are about the SRP that was done.
Okay.
So on the third molar in the quad, I always show my notes.
So you attach it to the very posterior tooth.
Exactly. Yeah, because the thirds are typically impacted or not there.
Right.
So it's a great place to sort of dump information about that quad. And I can quickly see, okay, I've got notes about the last time we SRP there, but no notes on that one.
Okay.
Yep. So over time, what happens is you start to look at this as a way of sort of a shortcut to look at the notes instead of having to read through an entire page of progress notes.
Right.
Cool.
Okay.
Yep. And that helps for both the front and back to get used to looking at the chart, the odontograph, but also getting used to having to quickly read through progress notes without having to, you know, read through how many times somebody has broken an appointment, you know.
Right.
So, makes sense?
Now, for the note, do you always put it in as a general note or a chart note?
All my notes are always going to be chart notes.
Chart notes.
That's the only thing I use. I use chart notes in the back, and I use general notes or count notes at the front. There's a million different types of notes, but the way I teach people to utilize the notes field is if you always write your notes from your chart, they will always be chart notes.
Okay.
If you write notes from any place else, they're gonna wind up starting as general notes, and you might have to fix them at some point. But if you start from the chart, which is where you should be, they're always going to be chart notes, no matter what.
Okay.
Yep. Same thing at my, as I teach people at the front desk, if you write them from your account, they'll always be account notes. But if you just go into notes from some general, from the schedule or something like that, they're going to be general because they have no idea what you're connecting it to.
Well, that's what we're finding is a lot of our notes are being put in as general notes for some reason, and we couldn't figure out why. And I'm guessing it's maybe they're going in and putting them in from the schedule.
Yeah. I find that people work from the schedule,
Yes.
which kind of makes sense, but in an operatory, it doesn't make sense that you're working from the schedule because of all the HIPAA information that's on that schedule.
Right.
Your schedule should be something you look at and then you hide. I mean, think about your cell phone. You never work from a schedule on your cell phone. You kind of work from like the main screen. You go back to the main screen. You go into your contacts. You go into your call log. You go into a game. So you kind of go back to a main screen, and that's why I love working from this main screen, because from here I can see everything. I can see, did the patient ever get that tooth extracted from the oral surgeon? I can see, all my IntelliCares to let me know. I mean, just from here, imagine you came and worked in my office. I would tell you immediately, I can tell everything about this patient, Charles. He has a hearing problem. He is overdue for his bite wings and for his full series. There's a private memo I should read about him. He has Blue Shield. He's on a 3-month recall. He's overdue for his prophy. He's got a treatment plan over $1,000. He's got referred services that haven't been completed yet, and we haven't verified his insurance. So from here, I can tell everything as opposed to looking at my schedule.
Okay.
Yeah. So this becomes sort of my home base, just like, again, a cell phone screen. I can tell how many messages are there, how many texts I have, all that kind of stuff. I can tell all that from the main screen as opposed to going into an app, and then I have to get out of that app to see other stuff.
Our students are having trouble with, opening the patient chart from the back office area.
Yep.
Whereas they're finding it easier to go into the schedule because the name is already there and everything, rather than having to type it into pull up a patient.
Well, I'll show you a trick. So This is what I do. As you can see at the bottom of my screen, I've got Eaglesoft here. I've got my schedule there, and I've got my chart. So, and actually I've got to go to another day where I have a lot of patients. Okay. So, all right, I'm done with Charles. I want to go into Tim. I'm going to hit my chart and see how it just flipped. Now I'm in Tim. It went right back to my operatory screen. I'm done with Tim. I save it. I go back to my schedule. I look and see who my next patient is. Oh, okay, it's Mrs. Barone. Click on Mrs. Barone. I hit chart. See, it went right back to the operatory?
Yes.
So I keep that open at the bottom because, we want to look at the schedule. So I go back to my schedule, I click on the next patient, and I click on my chart. So I do work from my schedule to see who my next patient is and see the name, but I don't keep that up. I just want to see it, who it is, and move on. It's like the screens at the airport. I don't need to stare at which airline I'm going to be on or what gate. I just need to quickly see that and get to my gate. So I want to see the patient, go to my schedule, click, move to my next patient.
So from that chart there, you put your notes from that bottom, that lower portion, correct?
Right there.
Okay.
Write my notes, save it, get out of that, back to my patient. Don't close it. Go back to my schedule, grab my next patient, open it up.
Okay, so leave it open and continue to go back and forth.
Exactly. Yep.
All right.
Yeah, the only hiccup is if this patient has a treatment plan to be written. If I have the chart open, the front can't write a treatment plan. But that's no big deal. Thankfully, I mean, in theory, I'm done with this patient. I should be moving on to my next person. So I'm going to hit save. I could go write my notes, but I'm going to go ahead and open up my next patient so that the front can utilize that chart.
Can the front walk that chart out?
They can. They just can't do a treatment plan. So they can't be in the treatment plan of the patient. They can't be in this part while the chart's open.
Okay.
Yeah.
All right.
Yeah. So again, this is one of those things. It's about muscle memory. The good thing about For You is you kind of cycle through people on a regular basis, students and also different providers. So, but in a dental office, if you've been working there for 5 years, 10 years, whatever, you have this muscle memory where you want to work from the schedule because it's like that's what you're used to. And I come into offices and I say, I don't care where you want to work from. If you want to go fast, this is the way to do it. If you want to do it your way, go ahead and do it your way. It's up to you. But to work from the schedule, for, like I said, for one, there's a lot of HIPAA issues with working from the schedule. And for two, it's really just not as informational as this screen is. Everything's here. So,
and that's what we're trying to teach the students is, there are HIPAA laws. You do have to protect privacy, things like that. And so we do want them to work from this screen just because there's less for them for the patients to see.
Exactly. Yep. Yeah. And the cool thing is, like, even here, I mean, I have this set up so there's information here that would be, I wouldn't want my patient to know what it meant, but this VIP in red lets me know that they have a balance over a certain amount and they haven't paid it. So they have an outstanding balance with my office. This VIP in yellow lets me know that this person breaks appointments and that's a problem for me.
Oh, okay.
So even though it looks like, yeah, they're a VIP, yeah, they're a VIP because it's very important that I talk to them about their broken appointments, and it's very important that I talk to them about their balance. But it's not going to be something, I don't have a dollar sign up here or something like that that might be derogatory. I mean, the patient's not going to get upset for me for having this here.
Correct.
So.
Okay. And those are the IntelliCare?
Those are IntelliCares. And basically it's something that says, if this, then that. So if a patient, and actually I'll show you where that IntelliCare is, because I always like to show people the IntelliCares for something like the VIP. So here's my VIP F, and anybody who's an Eaglesoft user can do this. It's simple. I have it set up. It's called VIP F, and it's based on the account. So if a patient hasn't made a personal payment in the last 15 days, and they have a balance that's over 30 days old, and their balance is between $1,500 and $9,999, then I automatically get this VIP symbol that shows on my appointment screen and in my clinical screen.
Okay.
So again, it's just an if this, then that. You have to kind of come up with what what would be a good number. I mean, a lot of offices, this might be $99. So anything over $100, I want to flag. And maybe if you want to go over 60 days, whatever the office decides they want to do, they can pick and choose how they show this. But the great thing is I don't have to go through a list of patients. Imagine going through an accounts receivable report and say, oh, let's flag Bill and let's flag Tom and let's flag this person. It could just, the system does it for you. And it's, it automatically shows up as, when they go 31 days, it automatically will show up on this patient's account that they haven't made a payment.
Nice.
Cool.
Now, each office can set up their own IntelliCares?
Yep. Yeah, you can do.
And how do you get them to show up in that corner?
So this little checkbox at the bottom says to show it on the virtual clinical screen.
Nice. Okay.
And then the top one says show it on the appointment screen. So one thing I always tell people about these IntelliCares is you don't want too many on the appointment screen because depending on the IntelliCare, it can slow your system down. In the operatory, it's not going to hurt. So I could have, I have some where you could have 30 of these things at the bottom of the screen. And I like them because it tells me a lot about the patient, but it could also show me medical information. It could show me all kinds of things that are really important to be able to see. So, and you can see at the top here, so due for a perio exam, review for bite wings, review for full series. They're missing a scheduled next appointment. They're missing insurance eligibility. They're missing medical history. So you can have all these things set up so that they automatically show. And then, like I said, you could have the PTC help you with custom. So these are all custom IntelliCares that I have in my system. And I have a million of them.
And that shows, you said health history as well, or alerts?
Yes. So that one shows me that the patient has not updated their health history.
Oh, okay.
But you can also, and I'll show you from the front desk, under general setup and under medical history alert. So if you're using the medical history form from Eaglesoft, or if you're updating that medical history in Eaglesoft through RevenueWell or something like that, that's actually connecting to the medical history in Eaglesoft, you can actually take any of these medical history alerts, the things that normally show up on that yellow box, and connect an icon to it.
Okay.
So I can easily show on my clinical screen that patient is HIV positive. I don't need that on my schedule. That's not a scheduling issue.
Right.
but it is something I'd want to see in the operatory. If it was something like, this is probably not going to be a typical one, but here's spina bifida. If a patient has spina bifida, a lot of people with spina bifida are typically in a wheelchair.
You're right.
So I could say, I need to see a wheelchair icon, and this wasn't a great example, but a wheelchair icon, and I want that on my schedule because maybe we have a certain operatory that's best suited for somebody who's in a wheelchair.
Okay.
Now, I don't need that in the clinical screen because the person's already in the office. We already kind of know,
Right.
it's obvious. So I don't need it in the operatory, but it's a great thing to have on the schedule. So if somebody's marked spina bifida, it automatically shows a wheelchair symbol.
Okay.
So you can pick
Now,
and choose those things.
will that take the place of the pop-ups? We have a lot of pop-ups that come up showing their medical history, and we don't want all those pop-ups to always be coming up.
It can, well, here's the thing. If you do a custom medical history form,
Yes.
okay, then you could, and you can see, like I have here breast cancer.
Yes.
I don't necessarily want that to pop up. And you can see that it's in black because I have it so it doesn't warn me. But I can only do that if I create a custom medical history form and then create new alerts for those things I don't want to pop up.
Okay.
So I have that one, and I have tobacco user. So those don't pop up. The rest of the things that I have on here do pop up only because of the situation here. But you can actually create your own medical history alerts. And see, I have this cigarette down here, and it shows me on my clinical screen, but it doesn't pop up.
Okay.
All right, but that's a whole another thing to create the custom medical history form. You've obviously created one in your office.
Yes.
Yeah.
Correct.
The problem is if you create a new one, the old information doesn't transfer forward. You don't lose it, but it doesn't transfer forward. So you have to, January 1's a great time to create a new one, and then everybody has to fill a new one out after that.
Okay.
Cool.
Great.
What else can you think of? I think we got a couple more minutes before this thing cuts us off.
That really answered a lot of my questions. Cool. The information about the notes was very helpful. So I appreciate that. Other than that, I like the information about putting the license number in.
Yeah.
And I think that would really help, our staff to know that the doctor did check everything.
Yeah, and hygiene too, because hygiene, they also have their license is on the line too. So I always say, at the bottom of every note, the provider should sign off on that note. Hygiene typically writes their notes contemporary to the procedure, but even if the doctor is writing notes, comments about a hygiene patient, they could certainly sign off on it with their signature, which would be their license number.
Okay.
Cool.
All right.
Well, Rachel, thanks for hanging out with me. I mean, it's a Monday. So, are you guys in business, or you're shut down for the time?
We're shut down.
Yeah.
So the school is closed, and the clinic is closed.
Yep. So hopefully we're out of the woods soon and back to business as usual.
For sure, that would be nice.
Cross our fingers. Well, thanks again for hanging out with me today.
Thank you. I appreciate it.
Oh, my pleasure. Talk to you soon.
Have a great day.
You too.
Bye.
Bye-bye.